This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hello, everyone. Welcome back to the Beat Podcast, recorded live at Vive from Nashville, Tennessee. I have the privilege of hosting two outstanding leaders in the business today. First, I want to introduce you to Misty Grambow. She is the Healthcare Business Development Consulting at U.S. Bank. I also have Tom Priedeman with us, who is the head of U.S. Bank's middle market healthcare team. It's such a pleasure to have both of you guys on the podcast. Thanks for joining.
Thanks for having us.
Yeah, thanks for having us.
So how is the conference going for you guys?
It's been great. Obviously, a lot of folks, a lot of buzz, and had the opportunity to attend Health last year. And so thrilled to be here at Vive. And I just say a ton of energy around the space and the conference. And it's been great connecting with a lot of folks across a broad spectrum of different healthcare technology companies. So really enjoyed it thus far.
Nice. What about you, Misty?
Absolutely. And I apologize. I'm losing my voice because I have met so many people and had so many meaningful conversations, right? But yeah, it's been amazing. This is our first year here from a payments perspective. And it's just been great, all the different connections and the different conversations and just the way that we are able to, like Tom said, that broad audience that we don't always see in our space. So it's really great to branch out.
That's fantastic. Well, glad to hear it's going well for you guys. It's a pleasure to have you at the meeting. Let's get into it. Talk to us about how your organization is helping drive change in healthcare.
Yeah, well, obviously we're a bank, so we're really at the intersection of financial services and healthcare. And when I think about the overall impact we have on the healthcare industry, it's really from a capital perspective. Obviously, we're the fifth largest bank in the country. And so we have a large healthcare team that goes from banking and individual doctor practice to some of the largest healthcare companies and systems in the world. And so we have a broad array of solutions that really service these clients. And so when we think about kind of advancing healthcare, and more specifically, I think the real reason we're here at Vive is around our payments capabilities and how we service healthcare organizations and revenue cycle management teams. And it's been a big focus for us. A large part of our business is payments. And given that healthcare is around 18% of GDP, there's a lot of payments flowing through the system. And so Misty and her teams do a lot of work on that front, and that's the reason we're here today. So,
yeah, I mean, as Tom said, we have a dedicated healthcare team, so we're very specialized within our verticals at U.S. Bank. And part of that is just so that we can really support healthcare clients in every way that we're able to. As he mentioned with payments, part of what we focus on with payments in making things meaningful are really listening to our clients and asking, what change are you looking for? What gaps are in the industry? What can we help? And sometimes that's as simple as removing things versus adding things. But attending conferences like this allow us to network. And whenever we do need to fill in those gaps with perhaps a fintech or AI or third-party solutions, then it allows us that opportunity to network with those customers and those vendors and to see what's out there to make our solution even more successful in the space.
That's great. Really appreciate you guys sharing what brings you here to the conference and how you're creating change. As you guys have been here, what are some of the common themes and pain points you're hearing from clients?
Being at the conference, I get the pleasure of touring around the country and meeting with a lot of different types of healthcare organizations. My team specifically covers everything from healthcare IT businesses to providers to payers to device companies, diagnostics, you name it. And so I'd say common themes that we continue to hear are really around finding ways to drive automation and to drive a better healthcare experience for patients. And so obviously as a service provider on that side, we're really focused on finding ways to do that. And I'd say that the overall themes we hear at the conference and when we're meeting with our clients is a lot of excitement around, I think, what will be a tremendous amount of innovation and new businesses that are trying to solve problems that make the healthcare system more efficient in general.
Definitely agreed. You know, as I stated, we're uniquely positioned. A lot of what we hear from our healthcare providers is My patient payments are the bulk of what I do, but man, my challenges and my heartburn come from those non-patient payments, right? Having to negotiate and leverage different contracts and vendors and manage those relationships, and then to find a provider that's able to help manage all of that while not just supporting what you have, but working with you at where do you want to be a year from now and 5 years from now. So like Tom said, those are the challenges that we're hearing. And so we would like, when we're working with a client, that's really what we hone in on, right? But I don't always like to just focus on challenges. So sometimes I think we get so hung up on what's wrong, we're not looking at what we need to change or update to make things right. So that's something that we really try to work with our clients on. And our partnership with US Bank, we're able to offer such a unique response to clients because of everything that we provide. A whole suite of solutions can be provided within one company. So again, just really, really can knock down a lot of those pain points very quickly for a client.
I really appreciate that. And it's great to have that one-stop shop. One hand to shake is the best way to go in my mind. So really great to hear that. So there's a lot around AI and different technologies and trends. What trends do you all believe will have the biggest impact on healthcare?
Yeah, I know AI is just becoming such a buzzword across every industry. It's hard to turn on the television, not hear about AI or talk with folks about AI. And obviously it has implications across industries far beyond healthcare. But when I think about AI in the healthcare setting, and I really think about it from a patient perspective of how do we make the healthcare system more efficient and provide a better care experience is where I get so excited. And as I mentioned, obviously get the pleasure of meeting with a lot of different organizations from big systems to new innovative companies that are trying to solve a new problem. And I would just say technology and AI in general of getting clinicians and doctors back focusing on kind of what they care about most is the patient is super exciting. And I think that'll be a game-changing experience for a lot of folks as we kind of fast forward over the next few years. And so I think that's a common theme that we hear. And then as you think about our audiences typically in the CFO or treasurer or revenue cycle management teams, and how can they run their financial systems more effectively, and AI and technology obviously have big implications on that. And so as you think about the overall stability of healthcare providers and running a more efficient organization, that has benefits for everyone and all stakeholders involved. So I think I'll get on the AI train with everyone else and just say, I think exciting things ahead for the healthcare industry in general.
Love that, Tom.
I think AI is exciting. I also think, though, it's going to bring in a lot of implications with cybersecurity. We've seen it with Change Healthcare and things that have happened, just those conversations that are taking place around how does this affect the data we manage? How does this affect our patients? So I think in healthcare, you're going to see almost a two-pronged. You're going to see as that AI comes on, there's going to be a lot more focus in data security, how we manage that data, who's viewing that data. And I think that's going to become even more of a bigger buzzword than AI when it's all said and done.
Yeah, no, great call out. The cybersecurity challenges that come with it, the bad actors are leveraging it, to your point. So we got to be careful. And we could learn a lot from finance. Frankly, you guys are way ahead compared to healthcare. So I think it's great to have your perspective here at this meeting as well. So lots that we can learn from our finance partners here at the conference today. So looking ahead, where do you envision the integration of advanced technology transforming banking and payment services in a way that enhances patient financial satisfaction?
Yeah, I mean, I think we're already seeing a lot of it. If you think about how you used to pay for as a patient, a few years ago, that's changed a lot. And I think you already mentioned financial services and banking in general, we've been forced to fit into kind of a consumer-based approach of we need to provide our customers the technology and the ways that they like to have their banking services. And I think healthcare is a few years behind us on that, in the sense that now folks are realizing that from a payments perspective, we need to be there too. And we're doing a lot of that today. And I think there's obviously continued room for improvement, but that's something we help a lot of our clients with, is how do we help them provide them the technology and the ability to get paid by their patients the way that those patients want to be paying. And so that's something that's a big focus for Misty and her team and the rest of the bank around the payment side. And I'll just note from a priority standpoint within US Bank, patient payments is super important. We did an acquisition of Salucro last year to bolster our patient payment capabilities, which was a big strategic move, an important move for us to make sure we had the right tools that were necessary to service the clients and what they're asking for. And so it's not just something we kind of do, it's something that is a core part of our fabric and a key part of our strategic focus as we think about servicing the industry.
We're all seeing this as patients, right? Whenever you're logging onto your phones, one of the things I've always said in my 15 years of enterprise payments is it should always be easy for you to accept my money. So at the end of the day, I think healthcare systems are now getting on board with that, with my chart and the mobile payments and the ability to do my, e-check-in. All of that really increases the revenue stream, right? And the availability of the funds that come with that. So I think it's twofold. It's an improvement for the healthcare system to be able to increase that revenue cycle. But in addition, the patient is also able to walk in to care, as you mentioned, right? And I'm not worried about my billing. I always use that example of I had a daughter who had a surgery, and I would have loved for somebody to reach out to me beforehand and say, hey, we're going to go ahead and tell you exactly how much you owe and set everything up, your payment plan, so that you can focus on the recovery for your daughter. So I think healthcare is kind of catching on to, like you said, the finance piece, that there is a patient relief in knowing what that is up front and also making it easy to make those payments. So it just becomes part of the healthcare journey.
Yeah, that's fantastic. It's great to hear the commitment that you guys have to the space. It's certainly an area that needs a lot of help, and glad your guys' brains and business is behind helping us there. So what would you say is the biggest pain points that you are focused on to help these healthcare organizations?
Yeah, I think there's a tremendous amount of, if you think about the last couple of years for providers specifically, they were challenging strains on labor costs and a lot of different other things as we came out of the pandemic were extremely challenging on the financials of the overall provider world. And I would just say some of the pain points that we think about and we focus on that we can help with is really around increasing payments collections. And as we kind of alluded to, the automation component of making it easier to get paid. And on my previous comment around that mechanism, if the mechanism to get paid isn't the preferred method, that might be a reason why someone doesn't pay. And that's an extremely expensive item for providers. And so I think as we think about that, how do we help solve for that, making sure we're thinking about innovating those systems that those providers can use. I'd also mention one thing I think that we continue to hear from our provider clients is around patient refunds. As out-of-pocket expense continue to increase due to kind of high deductible plans. And that's something that we continue to see is patient refunds are a challenge, and they're something that providers have to manage too. And so we help on solutions, helping alleviate that, automate that, and push out payments in the mechanism that makes sense. And so I know you're hearing payments a lot. We're a bank, so obviously it's a big focus for us, but those are a few of the big pain points on that front. And I'll let Misty jump in and kind of share. She's more in the weeds on a lot of that stuff. So
sure. I would say, again, the pain points I think are integrating that in to the healthcare journey. And what I mean by that is making that where it's part of the process. So we're working with our health systems to adopt, obviously, touch. So we're not having to insert the card, right? Tap to pay. We're working with our health systems on perhaps they want to get rid of the WOW cards. How do we do that? Maybe they're a bit overwhelming or you have small examination rooms, right? So we're working with our healthcare systems on adoption of sleek mobile payments using new cases. That's something that we look at, right? Real conversations on what is it you're trying to do and how can we implement this? Because every health system has their own culture. Some are extremely high tech and some aren't, right? Some are looking for a different feel. Everybody has a different, I think, pain points, but those all seem to be fairly universal. And how do we make this more seamless for the patient, but also incorporate it in our culture and our payments ecosystem?
Well said. No, that's really great and insightful to hear those key pain points. This has been a really great conversation. I want to thank both of you for joining us today and give you an opportunity to leave our listeners with a closing thought. So what should they be thinking about? And then what's the best place they could connect with you and reach out?
Yeah, thanks for having us. Really appreciate it. It was a pleasure chatting with you today. I think the combination of financial services and healthcare, we can do powerful things together. And I know Obviously, as a bank, our job is to help support financial experience for patients, creates a tremendous amount of upside for providers in the sense that they can spend more time, energy, and resources focusing on the patient. And so that's something that I really do believe in. And whether it's in the provider space or we're thinking about lending to a diagnostics company, medical device, services, anything, obviously growth and innovation need capital. And so as the fifth largest bank in the country, it's something we're committed to the industry and will continue to be committed to the industry. And so I would just urge anyone who's interested in having a conversation to please reach out, LinkedIn, whatever it may be. Happy to chat. Really appreciate you spending the time today. And yeah, I'll let Misty kind of add what she'd like to do.
Thanks so much. I agree with Tom. I think our group is passionate about providing solutions that make our customers more successful. I would agree with him. It's certainly not hard to find us. So I think we're pretty prominent in the industry. So we work with many large healthcare systems. And LinkedIn, email, come by our booth. But we'd love to chat with y'all and partner with you on anything that you have.
Outstanding. Well, there you have it, folks. Check out the show notes for ways to get in touch with Misty and Tom and the U.S. Bank team. They're here to help you fuel your growth and opportunities, from business opportunities to patients. They're here for you. So check them out. Thanks for tuning in, everyone. And Tom, Misty, appreciate you guys being on.
Thanks so much.
Thank you.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.